Hi, everyone. Thank you so much for joining us today. We will get started in just a moment to give everyone a chance to join. In the meantime, you'll see that we have these virtual backgrounds. I'm going to put them in the chat box if you would like to use a virtual background as well. Okay, it looks like we have everyone who was waiting to come in. So thank you all again for joining us today. We're really excited to have you with us. This has been a very big year for ASH, so we've pulled in a few of our key partners to talk with you, as well as our entire ASH staff team. Because this call is set up in the meeting mode, we ask that you all remain on mute for the duration of this event. And we invite you to turn on your cameras. We'd love to see all of your faces. We've created Zoom backgrounds that I put in the chat box, so you're welcome to use those as well. And then we ask that you put your questions in the chat box throughout the event, and we'll answer them at the end during the Q&A session, as always. So to kick us off, I will turn it over to ASH's Executive Director, Laurent Hubert.
Thank you very much, Megan. So I want to welcome you all and thank you for your interest in our vision, which is a world free from the harm caused by tobacco, and our mission, which is to advocate for innovative legal and policy measures to end the tobacco epidemic. So you will hear about some of this today from our colleagues and staff. And I have to say that I'm really, really proud of the ASH team and what the ASH team and colleagues have been able to accomplish. We've been, despite being a fairly small team, we've been able to influence health policy level at the local level, nationally, internationally, and even globally. And so you will hear today about some of our work that we've done in Washington, D.C. to phase out the sale of menthol tobacco products, our endgame work in California at the federal level, the lawsuit against the FDA to accelerate a ban on menthol products. We've our work around endgame campaigns in Spain, France, New Zealand, and other countries which are advancing very, very fast. And also about our global work through the UN system, such as the UN Human Rights Council, and our support to the Tobacco Treaty, the WHO Framework Convention on Tobacco Control. So welcome you again, and cannot wait for you to hear this feedback and update from the staff, and I encourage you to interact and ask questions. There will be plenty of time for questions at the end. So Megan, back to you as moderator.
Thank you, Laurent. Our first speaker today is Dr. Carolyn Dressler. She's a retired thoracic surgeon and a key supporter of ASH and volunteer. She's involved in a lot of our work, so we thought she would be the perfect person to talk to you more about ASH's impact. So Dr. Dressler, I will turn it over to you.
Thank you, Megan, and thank you, ASH, all of ASH and activities for all that you do, and welcome to everybody who's listening. I decided when I was an early teenager that I was going to try and figure out a way to cure lung cancer from tobacco smoking. And it drove my whole education and my career. And, you know, when I look back at what I was going to say, it's not just my career, but it's actually been my whole personal life to have fewer people dying from tobacco. So it drives pretty much everything that I do. And working with ASH, who has the same mission. And you guys, I was looking at the logo, and Megan, I don't know if you can show it, but it actually says leading to zero tobacco deaths. So it's a very analogous to what I'm looking at as fewer people dying from tobacco. And if we could get to zero in my lifetime, that would be phenomenal. But yes, I've worked in tobacco control in a whole variety of ways, from taking care of patients who have smoked, and actually, you know, lung cancer does happen in people who don't smoke, but about 80% or more are in people who have smoked. So it's the #1 cause of cancer death in the United States and in most places in the world, in both men and women. Even in the United States, 1.5 times more women die from lung cancer than they do breast cancer. So if we could get that number down, that would make me very happy. So even as I've retired from, I call it income producing work, I'm still doing volunteer work. And it's again, because it's where my passion is. How to have fewer people dying from tobacco. And ASH has been one of the best organizations to volunteer with because they do work locally, regionally, nationally, internationally. And, you know, with the Framework Convention Alliance, they're a key member of that organization too, that works on the Framework Convention on tobacco control. So there's multiple ways that ASH is using to move forward tobacco control. And again, for me, to have fewer people dying from tobacco. So it's an organization that I support wholeheartedly. And one of the things that I have done is I retired. So I recently did my will. So all of my documentation of what to do with my, I hate saying it, but that estate that you have, you know, when you die. And so I have put ASH in my will to a substantial amount for whatever is left over when I slide into home plate, is that I want to go to helping fewer people die from tobacco. And ASH for me is one of the best venues in order to do that. So I would just encourage everybody, even if you're not retired, but we all should have a will, even if you're 22, stuff happens, unfortunately. So just basically you can very simply put in your will that you would like to donate money to ASH. And I know ASH has some mechanisms they're working on to help make that easier. So I would just have to say that I'm very proud to be working with ASH in every one of their aspects. One of the things that you'll hear Chris Postic talking about, I'm trying to figure out how we can do locally in my small rural county in Western Colorado. So there's so much to do. So I would encourage everybody to volunteer, participate, and donate. Thank you.
Thank you, Carolyn. We really appreciate your support of all of our work and your own impact as well. I'd like to turn it over next to Carol Magruder, who is the co-founder of the African American Tobacco Control Leadership Council. So Carol, over to you.
Hi, good morning, everyone. It's my pleasure to be here with you all and to support ASH. I have actually been working with ASH for 2 decades now. I date myself, but I'm from San Francisco, and San Francisco early on began doing a lot of global tobacco work with our little city money that we had. We had to fight hard for that. But we had the intercambios at that time, we were buddied up with tobacco control programs in other countries. So since I was married to a man from West Africa, of course, I picked West Africa, Senegal, and also Togo. And San Francisco hosted one of the first global summits at that time. And Judith Mackay came, and I believe that's the first time I met Laurent and Aminata Sek. You remembering all these things, Laurent? And so we began working on the Framework Convention for Tobacco Control. And of course, we thought that was going to do a lot more than it has done. It's an important step in our fight, but there's still a lot of fighting to do. And so ASH has been a partner with us and with our community all along this time. We've had some intervals where we weren't working directly together, but one thing that I've always appreciated about ASH is their way of respectfully engaging communities of color and African countries. There's a way to do it, and you know how to do it. You're actually a model for it, in my opinion, the way that you work and engage people who are not in your wheel in that way. And so you have stood with the African American Tobacco Control Leadership Council. We have been fighting resolutely to get menthol and flavored tobacco off the market since the Tobacco Control Act was passed in 2009 and menthol was left in. At that time, nobody thought anything could be done about that. And so we began the hard, long work of breaking rocks to get us where we are today with so many people engaged. I think we're all engaged, and we all see that it is possible, and that cities and counties and states are moving forward to take these products off the market. But ASH was there at the beginning. When we did press conferences, when we were shouting into the wind, ASH was there with us as a full partner. And when we had our historical lawsuit against the FDA for their inaction on menthol, ASH was one of the first groups that we asked to be a co-plaintiff with us, and was the first group joining us. And then we had the American Medical Association and the National Medical Association join in. And so that lawsuit has spurred the FDA to say that they intend to enter into the rulemaking process next year. Our lawsuit is still active. Our judge did not dismiss it as the FDA wanted when they announced that what they were going to do. So we will see in June of 2022 what's going to happen with that. But we're very excited about it. And then I also want to talk about the work that we've been doing around the violations to the Treaty for the Elimination of All Forms of Racial Discrimination, ICERD. ASH assisted us with and was the lead on helping to file the report that begins the process for that international complaints about what's happening or not happening with menthol and flavors in the United States. So we will be moving forward in 2022 with some resolutions for municipalities to embrace the end game, which is zero smoking prevalence by 2035 in California, and also to agree and to help fight that the violations against the conventions for the elimination of racial discrimination are actually predatory against African Americans in our country, and we want to be a protected class from the industry. So I just want to say that I'm grateful to be here, Chris and Laurent, Megan, Kelsey, Carol. I just appreciate all of you, and I'm looking forward to next year.
Thank you so much, Carol. We really appreciate the opportunity to work with you so often. You guys are a great organization as well. Next, we will start the ASH staff presentation portion. We'll have every member of our staff, minus one person who had a training today. We'll talk about the impact of our work this past year, something that they're looking forward to next year, just to give you a little better understanding of everything happening at ASH. And I also just want to quickly point out that at this time, we also have a matching grant going, meaning that all donations to ASH will be matched today through December 15th. So I'll put that information in the chat box as well, so that everyone has that handy. And now I will turn it over to our Policy Director, Chris Bostic, to kick us off.
Thank you, Megan. And since I get to go first, I just want to start by saying it's been so wonderful over the years to work with Carol and Carolyn. I really thank them for being on today. Just in addition to just the work and the support you've given us, just your faith in what ASH is doing lets me know all the time that we're on the right track. So thanks again. It's always wonderful to have you. I'm Chris Bostic. I'm the Policy Director at ASH, and I run our Project Sunset campaign. And I'm sure you know, Project Sunset is an effort to phase out the sale of commercial combustible tobacco globally at a minimum. And 2021 has been a bellwether year. We've been looking for this year for a long time, and it's finally come. When we started this program a few years ago, tobacco endgame, as it's often called, was a fringe issue. And I remember talking to folks around the world from 2015 on, just bringing this up as a possibility. And the reactions ranged from, that would be really nice if we could do it, to you people are crazy. But over the past 18 months or so, it has flipped. And now it's the norm to talk about tobacco endgame in any conversation about tobacco control. And so that's been really great to see, and was one of our early objectives. Well, let me give you some specific things that have happened this year that have just changed the landscape entirely. First, we had 2 cities in California implement a complete ban on the sale of tobacco products. That's Beverly Hills and Manhattan Beach. And you'll hear from John Mirisch from Beverly Hills later. He was instrumental in getting that done in the first in the nation, first in the world policy. Later that month, in January, the California State Public Health Department announced that they were going to put money behind getting rid of the tobacco epidemic by 2035 statewide. And that's a big deal. That's the biggest state. It's the 5th biggest economy on the planet. And they're very serious about it. And ASH is very privileged to be sitting on their state advisory committee. Later in the year, we had Brookline, Massachusetts implement their tobacco-free generation bill. And for those who don't know, tobacco-free generation with the capital letters means increasing the minimum age every year by 1 year. So basically, anyone born this century can never buy tobacco legally in Brookline. And there's also been some movement with tobacco retail licensing. Two cities, one in Minnesota, one in New York, have set up a system whereby eventually there will be no more tobacco retail licensing in their city, which will effectively ban the sale of tobacco products. You're going to hear a little bit more later about some great movement in Spain and France. The European community has announced earlier this year that they want to reduce cancer drastically. And as part of that, they've promised to end the tobacco epidemic because they can't do it otherwise. And just this morning, the New Zealand Ministry of Health put out a proposal that's going to go to Parliament that is going to get rid of the tobacco epidemic there within 5 years. And that includes the tobacco-free generation concept. It includes lowering nicotine in cigarettes so they're not addictive anymore, and a raft of other policies. We were very pleased last month, too, to see that during the FCTC Conference of the Parties, the delegation from Canada has proposed putting Endgame on the agenda for the next COP. And that will be amazing. It's never been brought up before at the Conference of the Parties. And of course, earlier this year, we released our sign-on letter, which asked governments around the world to at least plan to get rid of tobacco sales in their long-term planning. That now has over 150 signatures. That includes a number of public health schools, a number of cancer centers, and some global health groups from over 30 countries. And that the number of signatories continues to go up. And less specifically, it's been really gratifying. We have had trouble keeping up with the number of invitations to speak and to submit papers on Endgame. It's become the topic du jour, and we're fanning that flame as fast as we can go. The World Conference on Tobacco or Health was held this year virtually, of course, and their main theme was Endgame for the first time. We've also been talking to folks at the World Health Organization and the Treaty Secretariat, and also at CDC's Office on Smoking and Health, who has held several panels on Endgame over the past year and plans to do more. So thank you again for your attention and for coming. I'm going to hand it over now to Liz Ferguson.
Thank you, Chris. This wonderful update from you. Clear that been a very, very busy year for us and all of our peers in the tobacco control movement. Again, I'm Liz Ferguson. I'm the Chief Operating Officer here at ASH. I'm responsible for all the organization's business operations and financial obligations as well. I also lead our local initiatives here in DC, and 2021 has been a big year for ASH and our work to support local initiatives here in the district. As our friend Carol just mentioned, in April this year, together with the DC Tobacco Free Coalition, the African American Tobacco Control Leadership Council, and 94 other health organizations, we submitted a report to the United Nations Committee on the Elimination of All Forms of Racial Discrimination to demand that the US government take action to protect African Americans from the harms of mentholated tobacco products. As we heard from Carol, there'll be more action coming up in 2022 on outcomes from this report submission and other actions that are going to be taken. Also this year in DC, ASH stood with the Tobacco Free Coalition members to support the Flavored Tobacco Product Prohibition Amendment Act of 2021. This was passed by our DC City Council back in June, and the bill will effectively ban all flavored tobacco products, including mentholated cigarettes. Moving forward into 2022, we're anxiously awaiting the DC Council to fund and then fully implement this life-saving legislation that will protect the health of all residents of the District of Columbia. So stay tuned for more information on our work to get this bill actually funded and implemented to protect the health of everyone that resides, again, in the District of Columbia. We'd like to thank Mayor Bowser and the other DC Council members and all of you, especially our DC Tobacco Free Coalition members. Some of you, I see you're on this call, for supporting this important legislation, supporting ASH and our work, and for being here today. So with that, over to you, Nichelle.
Thank you, Liz, and thank you again to everyone for joining us today. I'm Nichelle Gray. I'm the program coordinator here at ASH, and I work primarily on development and special projects. And I definitely wanted to take this opportunity to highlight some of the advocacy tools that ASH produced this year to help advocates combat tobacco industry interference. Some of you may have been on the webinar series that we had earlier this year that kicked off talking about tobacco industry interference and its pervasiveness in policy. And ASH has had the privilege of providing the data again for the Global Tobacco Industry Interference Index, as well as producing our own US Tobacco Industry Interference Index again this year. And these reports really demonstrate how far behind the US is when it comes to tobacco industry engagement and public health policy. But they also provide best practice recommendations based on the guidelines of Article 5.3 of the WHO FCTC. So in addition to our reports that we worked on, we also created this new tool on our website, an interactive tool that we launched that tracks not only tobacco lobbyists, but tobacco lobbyist firms. So this new tool highlights lobbying firms in all 50 states and Washington, DC. And our hope is that advocates can use these tools to raise awareness about tobacco industry interference in their individual states, and really leverage media to highlight this issue. So looking ahead, we're hoping to continue updating and providing valuable tools and educational pieces like our webinars to assist the tobacco control community and the public health community. And with that, I will hand it over to Kelsey.
Everyone, I'm Kelsey Romeo Steppi. I'm managing attorney at ASH, and I work on our human rights and liability programs. If I had to pick one word that sort of summed up my work this year, it would be intersections. We work a lot on intersections every year, but this year we've been discussing the intersections between health equity and COVID and tobacco control and social justice and human rights and liability. And so much of ASH's work has been at the middle point of these intersections. I don't think anything illustrates that quite as well as the FDA case. As Carol mentioned earlier, ASH was a co-plaintiff in the lawsuit against the FDA for their inaction on menthol. We obviously see that very much as a health equity and social justice issue, but we also see it as a human rights issue. And that's why we have worked on local trainings in California and DC, and worked with our partners at the DC Tobacco Free Coalition and AATCLC to submit the report that both Carol and Liz mentioned to the Committee on the Elimination of Racial Discrimination. We see that as sort of a coming together point of social justice, health equity, human rights, and tobacco control. Asking this committee to hold the United States responsible for protecting the right to health of its citizens. So that report and the FDA work is a great example of those intersections. But I also wanted to point out that the FDA, while a huge victory, was a victory in a battle, and we still have to win the war. They have agreed to propose a rule, which, as many of you know, means we're just at the first step of this process. So ASH and our partners intend to remain engaged in that. And that's part of why the CERD work is so important as well. We want the US to know that the international community is watching what they're doing with this and how important it is. Another element of all of these intersections is how much writing we've been doing this year. Chris mentioned our invitations to speak, and our invitations to write have been off the charts as well. And we've been doing some very interesting writing that I think cross-cuts outside of just tobacco control. We have a forthcoming article for the British Medical Journal's 30th anniversary edition on social justice and tobacco control. And we also have one pending on liability. So using criminal liability as a tool for furthering tobacco control. And those are just two examples of the many, many articles that we've published or have coming this year. And then just one other intersection I wanted to mention was the one between sort of national, local, and international. We've been training local advocates on how to use human rights arguments and mechanisms to further their local work. Particularly in California, we've been working on teaching advocates what all these international acronyms mean and how to use them to, for example, further a menthol ban locally. So that's work that continues. And we also continue working at the national level abroad with a group in France who we are trying to help provide technical assistance for as they use human rights arguments to launch a campaign in France. And we still continue at the UN level, despite many setbacks because of COVID, to advocate for tobacco control's inclusion in human rights mechanisms at that level. So it's been a busy year, and I thank all of our partners and all of the staff for the support. And over to you, Carol. You're muted.
I hate when I do that. Good morning. My name is Carol Madam, and I am the project director for a grant issued by the California Tobacco Control Program called Advancing Momentum for a Tobacco-Free California. This has been a very active year for Advancing Momentum, as we have had numerous tasks to undertake, and we've done so pretty well. I'll share some of those with you. We've had a lot of success in social media. We launched a social media research campaign on the modes and messages that we best received at the local level. We have held micro-influencer focus groups. A micro-influencer is someone who has an extremely large following on social media. And what we did is found out from those folks, where do they get their messages? What messages do they tune into? And how do they perceive the end game message? What can we do to have them help us get the end game message out? Those focus groups were very helpful in assisting us learn where we can go in the future. We've also tackled a few other things along the way as we've developed a web page for Advancing Momentum, and that is endtobaccoca.ash.org. The web page is full of resources and information from our California partners about ASH itself, and stacked full of places where people can download some of the ideas that we've been working on this past year. That would bring me to that example, is that we have created several technical assistance materials. We've done direct technical assistance to very many locations in California, and from their needs, we've developed fact sheets, infographics, white papers, and along that line. I encourage you to have a look at our website. So this past year has been a very exciting one. Another success that I have to mention is that we hired Sawi Salmanu, who is the project coordinator for this program. She isn't able to be here today, but she's been extremely helpful in the implementation of the program. We have lots of good things scheduled for the future, and I hope that this next year will be, I know that this next year will be just as effective and interesting as this one has been. Thank you. Oh, back to you, Megan.
No worries. I'm up next. I am the Associate Director of Communications here at ASH. And a few things that were particularly exciting for me this year, obviously the media attention that we were able to garner with AATCLC around the FDA lawsuit, and then the sunset letter that you heard Chris talk about, those were really big for us this year. But the other thing for me has been the webinar series that a lot of you participate in actively, and we're extremely grateful to your continued participation and support of it. This past year in 2021, we held 19 webinars with over a dozen esteemed partners as our co-hosts, even more as speakers. And that's been a really valuable contribution to our tobacco control community. We have advocates across the US in all 50 states, including DC and Puerto Rico. And then globally, we have almost 1,000 attendees who have the opportunity to attend or watch the recordings. And so we just really appreciate your continued engagement in our webinar series. And as always, encourage you to add topic suggestions in the survey that comes at the end, because we want that to continue to be a valuable resource to all of you. Then what I'm looking forward to for next year is just looking for new ways for us to engage on social media using cutting edge strategies and global best practices. this year we had launched our TikTok presence and helped one of our partners in Spain also launch theirs. Through some of the work Carol was talking about, we also made trainings on TikTok. So I think that's been really valuable for us to stay on the cutting edge with new emerging social media platforms and strategies. I see Wanda on the call too, and I know she has also done the same and had a really good presence there. So I think it's fantastic that we keep looking for ways to bring the tobacco endgame message to more and more audiences who may not have already thought about it. So that's something that I'm definitely looking forward to next year. And I will turn it over to you, Laurent.
Thank you. And so you've heard from a few of the staff, and they mentioned a lot quite often our global work and our international work. And this is something over the past over 20 years now of high engagement with the treaty process. We've developed contacts and relationships with health ministries and NGOs around the world, which it's a blessing and really helping us a lot in our tobacco control and our health work, but obviously adds up a lot to our agenda. So, for example, this year we were alerted of this partnership, for example, in Spain between Philip Morris and a local community in Spain in an island called La Graciosa. And for example, this is a best, it could be like a poster child example of industry interference, and particularly in a community that in this context in Spain was a small island that's trying to be sustainable, be environmentally sustainable, be ethical, and so on and so forth. So we've worked with them. We have some colleagues here some people on the call, like Laura Salgado, for example, who's been helping us with this campaign. But for example, really trying to stop this partnership, which could create a very dangerous precedent in other countries. We also, for example, as Megan has mentioned, and also Kelsey, building the capacity of our colleagues around the world to use the human rights-based approach to address tobacco control. So we're working to train French advocates to use the Convention Against All Forms of Discrimination Against Women in order to highlight that more could be done in France, and so on and so forth. And we've had obviously to adapt to a fairly difficult working environment. Very suddenly, all of us were under, like the entire world, we had to deal with COVID restrictions and all the limitations associated with that. And unfortunately, we're still struggling with that. We have some trainings, in-person trainings that we want to do, and we have not been able yet to do, and we've been limited in some ways, but still been able to continue to do a lot despite those limitations. We're trying to do the best we can. But I think we have a really unique opportunity moving forward in the context of a COVID-19 recovery. Because we have to address the impact tobacco has on the individual, who has more of a risk of obviously having worse consequences associated with COVID, but so also because of the impact tobacco has even in the best of time on health systems. And so if we have future pandemics coming up, even if it's a new one in 10 years, if we continue having a high prevalence in a lot of countries, it's only going to weaken health systems and make it less resilient in the face of a pandemic. So Megan, is that okay if I bring a few questions because I want to bring it back to some of the panelists, and I'd like to start on the context of this concept of using a human rights-based approach. And Carol, if you can put you on the spot.
Laurent, before we go into the Q&A, we still want to turn it over to John, don't we? Or did you want to?
Of course. No, you're right. Sorry, my bad. Because you're right. It might be better to do that later. So I wanted to explain. But yeah, why don't we go do that when we have John, who's board member at ASH, to tell us a bit the very extremely innovative work that has been done in California, and really so much aligns with our vision and I'll read it exactly word by word, to advocate for innovative legal and policy measures to end the global tobacco epidemic. And there could not be anything more innovative than what California, and in this context, Beverly Hills, did by being the first community in the United States to really phase out the sale of tobacco products. So,
So next up, we will have Councilmember John Mirisch, who was the city of Beverly Hills mayor at the time that they passed the ordinance to phase out the sale of all tobacco products. So, John, we will turn it over to you.
Thank you. And thank you, Laurent, for the introduction, and Megan. But, you know, I quite frankly, I don't think there's anything so innovative about what we did. I feel it's kind of a logical step. You see on some of the screensavers that it says for Megan, Michelle, and others, path to ending the tobacco epidemic. Well, pretty simple. Stop selling the stuff. I mean, that to me is a fairly logical thing. And so it's more logic than innovation, maybe a little bit of guts, because the response to that from people is, and to give you just a brief background, is we have successively been in the process of limiting smoking and tobacco in our city going back 20 years. You know, in the days when smoking was allowed on planes, which people can't even believe now. But we then banned it in restaurants, and then outdoor areas, and then, you know, in outdoor restaurants, and then multifamily areas. And then we a few years ago, we're discussing, also with the help of the LA County Department of Health, specifically with Monty Messick, about the flavored tobacco bans. And of course, we also had banned or put the electronic cigarettes at the same level as tobacco. And when we were discussing this and all of the evils that came from it and how it was discriminatory and they tried to hook kids and all of these things, at some point, I suppose I was getting a little bit tired of the discussions. I said, wait a second, why are we talking about this? Let's just ban it. You know, is that possible? And our city attorney sort of looked and said, well, you know, you may be inviting legal action from big tobacco. They may sue you, but there is nothing to stop you or to stop us. And I made the point that there are certain things that are legal in the rest of the country that from a zoning perspective and a land use perspective, we don't allow in our city. It's perfectly legal, of course, to have a mortuary. It's necessary, not a bad thing, but not allowed in our city. Smelting plants are things that, you know, are you can argue necessary as well, not allowed in our city. Marijuana, which is allowed now in California, but the sales are not allowed in our city. So to me, that was sort of the next logical step. Why are we wasting our time? And so at that point, you know, the reaction was also from some of the other council members, you can't do that, or let's look at it. Now, our challenge was getting the business community to buy in. And from us, I would say the biggest pushback came from our hotels. We have hotel guests, and, you know, and they want to smoke, and they'll go elsewhere, they'll go down the road and that sort of thing. And so we had to reach a compromise, but it wasn't necessarily what the hotels wanted, which was to be able to sell cigarettes and tobacco products to anybody off the streets. And we said, if this is specifically for your hotel guests, you know, the compromise was you can only provide it to them through the concierge or through the room service and that sort of thing, because we figured if we didn't allow that, they could just send the concierge down the road to LA, purchase them and bring them to them. So that was the compromise. It was also very interesting how we eventually, when we reached that compromise, were able to get people to buy in. But, you know, I also had to point out a little bit of the hypocrisy, because I said, you know, is smoking allowed in the rooms of the hotels? Oh, no, we don't allow it. Well, why not? So why should you allow it at all? So we surmounted that obstacle. The biggest obstacle beyond that was we have a couple of private cigar clubs. And, you know, if we had 300 comments about this in concerns, it was about the cigar clubs. And we got comments from everybody from Arnold Schwarzenegger to Rudy Giuliani to Ted Lieu. Ted Lieu, who has been like one of the most, he's our congressman, one of the most ardent critics of Trump and that sort of thing. So from literally both sides of the political spectrum, they were concerned that people wouldn't have a place to go and smoke their cigars. So we did a carve out for that with the notion that this is a private club. It's members more or less only. It's not something that people can go there off the street. And that was our compromise. And so we instituted it on January 1st of this year. We have we offered our businesses help to try and transition from selling tobacco to other products. I at the time said, wouldn't it be great if you could go and buy kombucha instead of cigarettes? We have one or two that are trying to get an extension, and the council will look at that, but it needs to be reasonable. And I think the whole council is on the same page. Once we overcame those obstacles, once we eliminated the major opposition of the cigar club fans, which was most of it, and some of the smaller businesses, we and our community has supported this. So the thing is, you can do this. If someone says you can't do that, can you? The answer is yes, you can. And we're hoping that there are more communities that will do that. Manhattan Beach followed quickly after us. I don't think it's been, maybe partially because of COVID and people have had other things on their mind, including public safety. But this is a matter of, to me, public health and safety go hand in hand. And so this is a matter of great importance. It's one of the reasons I was thrilled to be asked to join the ASH board, and I feel that I can offer that perspective and want to be able to help other cities to take this step. And so that's where we're at. I see there's a question about, can members of the private clubs bring visitors? I'm guessing that they can, but again, for us, the main concern was it's not somebody people can go off the street like they used to go to Walgreens or whatever and purchase. You're not allowed to smoke on the street. We have a weird loophole that we're hoping to eliminate, that literally the only time you can sort of smoke on the street is if you're walking from a place to place, so you can't stand and loiter. Hopefully we'll close that loophole. And and we've garnered some publicity from it, but more importantly, the support of the community. And we strive to be a healthy, a safe, but also a very healthy community. And this is an important part of it. So when you see the path to ending the tobacco epidemic, Project Sunset, and other things, maybe it's a little bit bold, maybe it's a little bit of what we would call here chutzpah, that sort of thing, but it's certainly logical. It's not a wild idea. I keep coming back to a quote that Ruth Malone from the University of San Francisco, who has been so wonderful on all of these issues, has said, and I think I quoted her at the time when she said, never in the history of consumer products has there been a more lethal product than cigarettes. So maybe it's not so surprising that someone finally says these products are too dangerous to be sold on every corner. And, I won't go into the details about the tobacco industry. And they did have their lobbyists, and they were they weren't anymore arguing, at least, that it's not bad for you, but they were trying to use the kind of pseudo-libertarian, it's a matter of personal choice and that sort of nonsense. I actually see a similarity now between some of the discussions we have about the vaccinations and people who look at that as a matter of personal choice. But the fact of the matter is, when you're smoking and your smoke is being breathed in by other people, it's not just your personal choice, it's the way it impacts other people. And, if you live on an island, go smoke away. But when you're in a community like ours, or any community, it impacts other people. And I think that's what we're looking at. So, hopefully, as said, other cities will follow suit, and we're glad that we were able to take the first step, and we want to encourage anybody else and any other cities, and are happy to do so. Thank you.
Thank you so much, John. We really appreciate both your personal leadership and also that of the city of Beverly Hills. Your work in both areas is really an inspiration to a lot of us, and a fantastic example for our community of what's actually possible. And like you said, what's the logical next step? So at this point, I'll turn it back over to Laurent, who can moderate a Q&A session. So the chat box at the bottom is where you can type in any questions that you have for panelists or the ASH staff speakers. And we'd be happy to take any of your questions about our programmatic work, plans for the future, any questions that you have on that realm. And just again, as a reminder, we do have the matching grant that's also still going. So if you're looking to make a donation at all this holiday season, we hope that you think of us. So Laurent, over to you.
Thank you. Thank you. And I just reflecting back on John's comment, you made the logical, you said it was so logical to do this, but I really want to thank you and to congratulate you for your political courage and leadership in this context, because actually very few politicians are willing to take that step. And this reminds me a lot about smoke-free in the early 2000s. I mean, I remember, even in the context of the treaty negotiations, even having to argue with our own community, even the public health community, that we could get to smoke-free bars and restaurants. Even our community thought it was too radical, and politicians thought, oh, this is too dangerous, we can't go there. But what's interesting is after it happened, and when asked, when I understand Mayor Bloomberg, when he was asked, and also the French health minister and a few others, they all said, wish we'd done it earlier, wish we'd done it sooner. Meaning that actually there's often very large support for this. I know in Spain, for example, our colleagues did a survey, and they had like thousands and thousands of respondents. And even among smokers, the majority, for example, when asked the question, when do you want your child to start smoking? 90% said never. I don't remember the exact percentage. It was an overwhelming percentage, even among smokers. So there's probably a lot more support within the general population. And it's courageous political leaders like you that are needed to move this forward. So again, I want to take the opportunity to thank you for the work you've done, because we needed that leadership, so others will follow. I want to bring it back to, so I encourage everyone to ask questions. I mean, this is meant to be a bit of an informal discussions with friends and colleagues. And but I want to quickly ask a question to Carolyn. As thoracic surgeon, I know that you had to open a lot of chests, and you decided that just doing surgery was not enough. You needed to address policy. And then I know your time at Harvard, that's when you really started to, being one of the leaders or initiators of using a human rights-based approach to address tobacco. Can you expand on that just for a minute and tell us a little bit about what prompted you to do that and to really use this human rights-based approach?
Yes, so I will share. During the last year of my training, I got an asymptomatic case of hepatitis C. Hepatitis C ended my surgical career. And so hopefully I can finish talking about this without being in tears, because it was a very, very difficult emotional time for me. So therefore I needed to find something else that I was going to do to have fewer people dying from tobacco. I went to work for, at that time, SmithKline Beecham, then GlaxoSmithKline, in their medical director for global research on smoking cessation. And so I learned a lot. I met many people internationally, but it was very much in working on helping people to stop smoking through a pharmaceutical industry. However, it did teach me I am not a for-profit employee. It wasn't working for me for what I wanted to do in my life and career. So I had the opportunity to go to the Kennedy School of Government at Harvard. And while I was there, I was very much interested in looking international tobacco control policy. I had the remarkable good fortune to meet Stephen Marks, who's one of the global leaders in health and human rights. And he is at Harvard in the School for Public Health. I met him at a seminar. I asked him about the question about a human rights base to tobacco control. He paused and looked at me and said, I think you have something. So then I did an independent study for a year with Stephen Marks and came out with the paper looking at a human rights-based approach to tobacco control. And for me, it was very good because, as you all now know, doing all of this work, it's so applicable to use that human rights-based approach. It has a very good language to it. It's a legal language. It's something the US isn't particularly good at, but the rest of the world is through a variety of human rights conventions. But it was a very good way to base why having fewer people die from tobacco, as John said. It's just logical, but you actually can put legal languages to it. And Ash, you've been doing that so well. Does that answer that, Laurent?
Yes, thank you. And I saw there's a question on whether there's going to be presentation at SRNT, and there will be. So based on your response, Carol, then I have a question for Kelsey. So what are the next steps? You mentioned it's on the agenda for the next COP. You discussed some of the human rights report we've done. What are the next steps on using this human rights-based approach?
I could talk about next steps for a human rights-based approach all day, so I'm going to try to limit myself to a few. but we want to use it at the local, national, regional, and international level. We want localities using human rights language in their local laws. So, for example, in DC, they're trying to pass a menthol ban, and Chris and I have sent letters along with the DC Tobacco Free Coalition to council members illustrating why menthol is a human rights issue. That's a great example of local use of that, all the way up to the UN. The Human Rights Council uses a review process called the Universal Periodic Review, where every country who's a member of the Human Rights Council has to report every 5 years to that body. We want the UPR asking every country how they're doing on tobacco control. We want it to illustrate to all the countries in the world that the UN thinks tobacco control is an important human rights issue as well. So next steps are increasing reports from various countries, as well as making sure that human rights language is incorporated at all of these levels.
Thank you. And Chris, I want to go back to you now. So you mentioned the fact that the retail environment and even in-game were minimally addressed in the FCTC. The retail environment, the selling of cigarettes and the retail is only addressed in the concept of illicit trade and sales to minors and by minors. And you have a very good way also of articulating then what does a human rights, if you take a human rights argument or approach, what does that imply for tobacco control?
Well, thanks, Will. I'll try to be brief as well. That was one of the clearest things to me. In fact, when we decided about 6 or 8 years ago to move to a human rights-based approach, one of the things when you analyze tobacco control through that approach, within minutes you come to the conclusion that it is a violation of human rights simply to market and sell this stuff. It doesn't have to go beyond that. It doesn't have to be fraud. It doesn't have to be lying to the public. Just putting something out there that you know will kill people when used as intended is a violation of human rights. And we're not the only ones to have said that. So when you look at it specifically, there's something called the Ruggie principles in international human rights law. And this is named after a different Harvard professor of human rights. And it's basically a framework of protect, respect, and remedy. And it's to deal with third parties, especially corporations. The protect is the duty of governments to protect their citizens from violations of human rights. The respect applies to corporations. They're not supposed to violate human rights. And then the remedy applies to, if they have violated human rights, making people whole. So when you look at that, you see Project Sunset, which is holding governments accountable for holding industry accountable, and our criminal liability program to stop the industry from doing what it's doing.
Thank you, Chris, for this very succinct response there. So I see a few questions from Andrea. You have sent a few questions here. If there were a coalition that would like you to give an overview of Endgame, are you able to virtually attend this, or are you booked a long way? We can make sure that someone will be there. If Chris can, he will, and if he cannot, he will make sure that someone is there to present. And I believe that Chris will definitely present our SRNT. Is that correct, Chris? I think there's a few, you are presenting right there?
Yes.
Yeah. And Kelsey, I'd like you to expand a little bit on the human rights message, how well it's been received in the United States. We're seeing increased interest in it globally, and there's been an increased interest, and you heard from even Carolyn Magruder how she worked with us on the report. It was submitted, and how they've used that, started to use that for local advocacy. But Kelsey, could you expand on that?
Yeah, thanks for asking, Andrea. Human rights in the US is so often misunderstood, and it's almost a dirty word in the US. We don't subscribe to human rights treaties. We don't participate. So some communities, particularly progressive communities, human rights language is great and is fine. Some communities and broadly in the US, we found that using social justice terminology, which isn't exactly the same, but often has the same sort of ends, has been working well for us, particularly this year with so much attention on social justice, and also framing it as a health equity issue. I think with COVID, there's been so much attention drawn to health equity that reframing these things in health equity instead of human rights makes sense to a lot of people. But also we want to keep pushing that human rights language, because I don't think a lot of people who smoke consider themselves victims of a human rights violation. And when they start thinking that way, I think it's just a total game changer. So we are still trying to use that language, even as we consider other options.
And Kelsey, don't you think it's fair to say that other fields, even the United States, do use the human rights-based approach and rhetoric much more than we do in tobacco control?
Absolutely. I think the HIV/AIDS movement is a great example, and even the environment has become very much human rights driven.
Could you quickly just give that parallel of how CEDA, which the US has not ratified? So for example, the US has ratified the Convention Against Racial Discrimination, not the one on protecting women or children, but how there are very good examples of those are still used in the United States.
Yeah, I think CEDA is an easy example. There's an organization called Cities for CEDA that encourages cities across the United States to symbolically ratify the convention. They can't legally, because that's only at the federal level. But a lot of cities, states, localities have done this. And they're even taking language from CEDA to create laws locally. There was an example in Pittsburgh last year, a couple years ago, where the mayor directly took domestic violence language from CEDA to incorporate into their city's law. So we see this a lot, and we hope to see it more and more with tobacco control.
And there was a direct correlation between once that campaign was done, there was a decrease in domestic violence reported through police and others. So really direct correlation there. There's a very interesting question, and one that comes up all the time, and it's about, this comes from Jonathan Chaffee, and it's on what does the legalization of marijuana in the United States, in some states, but also in other countries like Canada and other countries, are Germany now is talking about legalizing cannabis. Spain, for example, I'm currently in Spain, where it's actually cannabis is legal. However, I think I'm going to pass it over to Chris, but first I just want to make a quick distinction here between consumption and sales, and really in the context of Sunset, really focusing on sales of the product. So we're not talking about criminalizing, for example, tobacco use. And what I find very interesting is that even when sometimes, to some extent, it was interesting when we were starting the discussions around Sunset, that when some people were talking about even strong restriction or what was happening in California, how they call that legalization. But if we were applying the same measures to tobacco, that would be considered, prohibition or phasing out. So kind of like the discrepancy between those two products. But Chris, can you please also expand on that?
Sure. Really quick, the very specific question about smoke-free air, I think, is an important one. And we should all recognize right away at the outset that breathing in smoke is a bad idea, no matter where the smoke comes from. And so anybody that has passed smoke-free air laws, and everybody should definitely include smoking marijuana in the ban. There's no sense in allowing that while you disallow other forms of smoking. The broader question of how marijuana legalization sort of fits into this is complex and very interesting. There are a number of researchers in our field sort of tackling that. If our main problem is that a lot of the general public sees this as contradictory, that we're decriminalizing marijuana while we are criminalizing the sale of tobacco products. We don't really see it that way. We think all products should be regulated according to the harm they cause. Now, we may find, now that marijuana is becoming more widely available, that they're much more harmful than we think. And if that's true, then our policies should change. But this should not stop us from getting rid of, by far, the most dangerous consumer product in history.
Thank you, Chris. And Megan, I see that we're at 7. So should I wrap up the Q&A?
Yeah.
Okay. So, we're ending the Q&A section. And I just want to mention that we've, in the past 20 years, like in this decade, in this century, since this century started, tobacco control has suddenly made huge bounds and leaps. I mean, we started with the treaty negotiations for the FCTC, which really led to a global consensus about how to address the tobacco epidemic, things that seem impossible, like smoke-free policies, plain packaging on cigarettes, which is the norm in a lot of countries, total advertising bans in many countries, and so on and so forth. Things that seemed impossible have become a reality. And I really, really believe that we are at a pivotal point when we're now there's much more acceptance for realizing that this is not a tobacco products and cigarettes are not a legitimate product for mass consumption. There's not a legitimate consumer good and needs to be addressed. So I really believe that in the next 20 years, we could really end this epidemic. And it would be really sad if with what we know today, if we're not able to address this with this issue, the issue of tobacco, with this developmental issue. If we cannot do that, it's really could be sad for humanity. And what does that mean for other big issues such as environmental change and so on and so forth? So I think we can really, really address tobacco now. And I think we're right at the right time in history to put us out of business, so to speak, as a tobacco control community. Megan, back to you.
Thank you so much, Laurent. I just want to take a moment to thank our guest speakers, Dr. Dressler, Carol Magruder, who was just with us, and Councilmember John Mirisch. We really appreciate all of your support and continued partnership with us. Again, a thank you to my colleagues as well for all of your hard work. Everything that we just discussed today is thanks to all of you. Then to our partners on the call, thank you as well. You all work with us on so many different issues, and we wouldn't have the impact that we do have without your continued support as well. As I said before, we have a matching grant going right now where donations are being matched through December 15th. We have the link on the screen. There's also a text to donate option. Let us know. Feel free to respond via email if you're having trouble finding how to donate. But we truly, truly appreciate each and every one of you through your support of various means, whether it's in your state like you have, Dr. Dressler, or through an online donation. We really appreciate all of you. And we hope that you have a safe and healthy holiday season with your loved ones. Bye, everyone. Thank you.
Bye. Thank you.